Good evening, everyone. Welcome to Radiology Academy. Today class is about pelvic kidney. Here you can see the kidney was not at normal position. It shifted to the lower under the pelvis region. Case it called pelvic kidney. Looks normal function was performed. Kidney small because of the area was not that much for this location, so that the size was not that much. So let's get start from the kidneys. Sometimes you found that type of problem or that type of patient, it's not maybe problem, it's abnormal. Here you can see the kidney placed under the pelvic area, and the shape of the kidney was different, so that everything seems like different, like what happening. In first case, if you see the arterial phase, but it's normal just because there was no any type of stone on in this kidney. Also in right side there was no any stone. Also look at the delayed phase. It properly shows the left-sided ureter goes to the bladder was properly view in this delayed scan. So this is a different scenario. Sometimes you found the type of patient, so it's normal. It's happened by birth, some type of defect. So in cornel it's look like this. So next patient is polycystic kidney. मैं बहुत सारा पेशेंट दिखा है जिसका ऐसा प्रॉब्लम है। यहाँ में देखने से जो एब्डोमेन है वो टोटली भरा हुआ दिखाई देता है, जो कि इसके वजह से है। टोटली भरा हुआ दिखाई दे रहा है एब्डोमेन। ये जो एरिया है, जो नॉर्मल एनाटॉमी है, वो यहाँ में डिफरेंट हो जाता है, क्योंकि ऐसा कोई केस हमने पहले नहीं देखा है। सो हियर यू कैन सी इन दिस एरिया In this area, this is the right kidney. Sorry, this is the right or this is the left. You can see full, every part of the abdomen is covered by kidneys. So if you found that type of patient, it's called polycystic liver also, polycystic bladder also. It's called, yesterday I show you that thing. So if there was a lots of cyst, it's called polycystic. Just keep it in mind. Also we have a abdomen. Here you can see in this venous phase I found different thing, but yet I don't found the report or I don't found the diagnosis. I just see there was a lesion in this area. I don't know which organ connect with this lesion. The image looks pretty good in 0.8 mm image. This is the 0.8 mm image. In cornel it's look pretty good. Right now I don't know what is the diagnosis or what is the problem in this patient. If you see in the upper portion of the bladder, it's like it's not connected with bladder, so it seems different lesion in pelvic area. It's not properly connect with the bladder, so I don't know properly what is the diagnosis of these patients. It's maybe nodes or something else, but it's clearly some type of tumor in this area. If you found that type of problem, you will be include the arterial phase in this area. Here you can see we found lots of tumor causes bleeding, or it's different to operate just because in arterial phase we know the arteries goes under which artery supply this lesion, so we find out what is the type of the lesion, so we need the arterial phase. In radiology you have to find what is the best option for best scan for the patient, so that we are called technologists. This is the lesion, and here you can see the artery goes under this lesion. So I tell you what is the diagnosis tomorrow. This one more patient of shoulder joint. Normally shoulder joint it's go to a single view. Here you can see this is the shoulder joint, but here you can see the FOV was bit more. So in MR you don't have one single thing that the FOB was needed that much for shoulder joint. So it's not just because there was a lots of patient with lots of different diseases. So we increased the FOB for the need, and according to the sequence we need some different value of the sequence, so we get the proper result. Also we try with different sequences. If we found that type of problem in shoulder joint, the sequence is just FOB was increased in this scenario, but sometimes you have to include the humerus bone with shoulder. So in that point we have experience, we need to increase the FOB or need to change the sequence. That's because shoulder sequence was not good if you good result if you increase the FOB. So we have to shift we have to plan with different sequence. So in MR you have to experience lots of things so that the proper diagnose or the proper sequence was needed for the patient. If you think those 6 sequences, those 10 sequence was enough for the shoulders or enough for the knee, it's not happening. Just because in MR the patient problem was different. Every patient have different problem. Here you can see the shoulder joint FOB was bit more that much, but you can see the FOB was increased according to the needs. Also sequence also change according to the needs of the patient. So this is the scenario. This is a T2 steer image, but here you can see everything look like different. It's not normal steer image. Here you can see lots of enhancement, hypodense area. Also here you can see in T1 there was a lots of bright area. So it's not like properly identified whether it is the fluid or this is the abnormal issue. We don't find normally, but when we can view the different if you plan a patient history was needed, so we found the X-ray bit brighter in this area. So after the MR we take the CT scan of the shoulder. Here you can see the bones look like different in this sequence. Everywhere seems like bone. So after we compare and view all the images, it's like bony CA. So in this case we totally increase the every sequence FOB. So this is the T1 says. This is the PD cornel. Since the we saw that there was artifact in this area, so it's happened just because this is not normal sequence. We can sense according to the FOV with some other things we have to increase, because in MR you don't change the FOV for every sequence. मतलब क्या होता है कि MRI में FOV चेंज करने के लिए दूसरा जो भी फेस ओवर स्लैम्पिंग और बहुत सारा होता है, रिजोल्यूशन के लिए होता है, वो सब चेंज करना पड़ता है यदि तुम FOV चेंज करोगे, और फेस फॉलोइंग ये सब चेंज करना पड़ता है। नहीं तो क्या होता है, जो डिटेल है और जो आर्टिफैक्ट है वो दिखाई देता है, और तुम दूसरा सीक्वेंस यूज़ करोगे तो उतना FOV का तो अच्छा आता है। You can see this is the T2FS sequence. So in this point it's properly work well, but after the FOV was increased, it's not showing, it's showing the different artifact signal loss. So we have to plan the proper sequence with the proper coil. After seen lots of MR, you can find what is the best combination. I'll show you a little bit of that. मैं ये थोड़ा बहुत दिखाने की कोशिश करूँगा जब भी मेरे को ऐसा कुछ पॉइंट मिले। एक्चुअली जो चीज़ मैंने एक्सपीरियंस किया है वो ही शेयर कर सकता हूँ। तो व्हाट इज़ द पॉइंट इज़ नीडेड, आई विल शेयर इन द वीडियो। तो यहाँ में देखने से जो शोल्डर जॉइन है उसका टोटली डिफरेंट दिखाई दे रहा है नॉर्मल शोल्डर जॉइन के मुकाबले। सो ये PD सीक्वेंस है। यहाँ में तुम जो ये मसल है, मसल का जो कॉन्ट्रास्ट है PD में ऐसा दिखाई देता है, जो कि इस एरिया में फ्लूइड और बोन का कॉम्बिनेशन है, स्वेलिंग है, इडिमा है, so that the normal anatomy is not look like that। मतलब क्या होता है कि जो नॉर्मल एनाटॉमिकली जो वो होता है, कॉन्ट्रास्ट होता है, वो यहाँ में उनको नहीं मिलेगा क्योंकि ये एबनॉर्मल है और यहाँ में प्रॉब्लम है। इट्स नॉट एबनॉर्मल, देयर वाज ए प्रॉब्लम, सो इट्स सीम्स लाइक डिफरेंट। दिस इज द स्टीर सेस। Also this is the T2FS, it's same sequence, T2FS, T2FS, this is the T1, T1FS. After the whole sequence we get the contrast. There you can see contrast enhanced randomly everywhere. Showing enhancement everywhere. So it's showing that type of enhancement if there was a bony Polymaths malignancy. This is the CT scan of the patient. Here you can see everywhere the bone was like बोन जो है वो मतलब खा लिया है, मतलब डिस्ट्रॉय कर दिया है, ऐसे दिखाई दे रहा है सीटी में, जो कि नॉर्मल नहीं है। और नेक्स्ट नॉर्मली लिख दिया है। नेक्स्ट नॉर्मली कोई जॉइंट का सीटी हमारे, हाँ नॉर्मली जो बोन होता है वो ऐसे दिखाई देता है सीटी में, लेकिन वहाँ में बोन है ये टोटली मैच की वजह से डिस्ट्रॉय हो गया है। सो इट्स शोइंग डिफरेंट एनहांसमेंट एवरीवेयर। So this is the case for today. Hope you found new information in this class. Thanks for watching.